Hey there. So in this meeting, we'll be discussing and we'll be seeing that some of the responses which we are getting from this working, demo model. Uh, we'll be just, giving some, asking some questions as a patient, and then we'll get the responses, whatever response we are getting. Say, for example, the first question which I've asked that what could be causing my frequent headache and sensitivity to light? I asked this question to this model, and the responses are like this. Like it has analyzed and presented that it could be the maybe due to migraine, tension headaches, cluster headaches, sinusitis, medication overuse, headache, or underlying neurological symptoms. It has recommended something that maintain a diary for the tracking of a headache, severity, and potential triggers. Consult a healthcare professionals. A comprehensive like evaluation. Consider lifestyle modifications such as stress management, irregular sleep patterns, and balanced diet. Avoid overuse of pain medication, and explore some alternative therapies like acupuncture, massage, and under medical make sure that you get it under medical guidance. The analysis and reasoning behind this, as per the question which is asked, the symptom described frequent headache and sensitivity to light are common presentation of various headache disorders. While these systems can be deliberating that they are not typically immediately life threatening, however it is essential to consult healthcare professional to rule out any underlying condition that may require prompt attention. The condition level is 80 due to non-specific nature of the symptoms, which could be attributed to multiple causes. A thorough medical evaluation is required, including physical examination, medical history, potential diagnosis test. It is necessary to determine the underlying cause and develop an effective treatment plan. Okay, so let's have another question. Okay. I have a runny nose, sore throat, and mild fever. What might this be? Okay, let me ask this another question to this chatbot, and let's see what type of responses we are getting. So I put up this question, and it has analyzed the severity. Emergency level is low, and AI analysis summaries patient with a symptom of running nose, sore throat, and mild fever, which are commonly associated with upper respiratory tract infection. It is URTI, maybe common cold, influenza, or allergic reactions also. So it has recommended that stay hydrated with in taking plenty of fluids. Use over the counter medicines such as some medicines which has been provided. Practice good hygiene including frequent hand wash, avoiding close contact with others. Consider getting tested was influenza symptom if it worsened. And it has also given some analysis and reasoning. Okay. Let us check about the third question. This question related to like why do I feel tired all the time and have lost interest in things I used to enjoy. So let's ask this question, and these responses are here. So it could be like the area of concern could be depression, emergencies medium as you can see, and area of concern could be depression, anxiety, chronic fatigue syndrome, hypo thyroidism, anemia, or sleep disorders. It has recommended schedule appointment with a primary, healthcare physician for the comprehensive, evaluation. Undergo a physical examination or laboratory test if it is required. Consult, considering consulting a medical health professional for further assistance and guidance. Engage regular physical activity to practice stress reducing techniques. Improve sleep habit and maintain a balanced diet. And also reasoning behind that. A patient's symptom persist of fatigue and loss of interest in activities could be involved into medical health conditions such as depression, which require prompt evaluation treatment while not immediately life-threatening. These systems can be significantly impact on daily function and quality of life. A comprehensive medical evaluation is necessary to rule out underlying medical conditions and develop an appropriate treatment plan. The patient's symptoms do, not appear to be immediately life threatening, but they do require attention further assessment. Okay, and there are some medical reference source also. So let me describe about this disease, like description and then common symptoms. Let's see what type of response I'm getting from this chatbot. I have not mentioned the name of the disease, but let's see what type of response we are getting from it. Description: a viral, you know, infection affecting the respiratory systems. Common, symptom: fever, cough, sore throat, running nose, and headache, fatigue, like this. So, uh, all from all these symptoms, it is shown that it could be a viral respiratory infection, potential for secondary bacterial infection, risk of dehydration, especially if vomiting and diarrhea are present. Okay, worsen underlying conditions such as asthma, chronic obstructive pulmonary disease, COPD. And then it has recommended some stuff also, as you can see, and all also AI proper analysis and reasoning. Okay, let me put up this question, another, a different kind of question. Okay, it is related to diabetes. Let's see what type of response we are getting from this model now. So we're changing the type of question so that it can we can get a proper analysis from the uh, you know model. So it has diagnosed likely indicating a diabetes mellitus. An area of concern that hyperglycemia, dehydration, electrolyte imbalance, increased risk of infection, neuropathy, potential of diabetes, and all these things. So it has, on top of like symptoms which we are getting, it has analyzed and got that these are the due to these symptoms, this could be the disease. Like a chronic condition affect how the blood pressure, blood process, blood sugar, like increased thirst, frequent urination, hunger, fatigue, blood vision, and a slow healing, source, weight loss, and tingling numbness. So the model is actually interacting and giving the actual responses as per the questions which is being asked, and it is almost accurate. Its analysis is almost accurate, and also recommending you that what all actions you can take, and what could be the concern area of concern, what is the severity of the problem, and what type of like medical aid you can get, and what all things you can take care of. So a comprehensive analysis which has been given by the chatbot, and it is also recommending what the proper diagnosis and what type of consultation a patient should go through it. So this is what we have seen in this presentation about like this chatbot, how this chatbot is behaving, and how we are getting the output from this chatbot as per our different various kind of inputs which are provided. Thank you so much.